Now, let's have a look at back at the COVID situation, should we? Because, as we know, the government has told schools to reopen their gates for certain year groups at the younger end of the spectrum from Monday. Unions aren't happy. Councils are saying it's not necessarily safe. Well, let's talk to the Chief Executive of the Early Years Alliance, Neil Leitch. Good morning to you. Look, what's your view on whether or not this should be happening?
Well, we represent early years settings, so predominantly children under the age of 5. And I think it's a mixed picture. I have to say that, from children's benefits and from parents' benefits, we have to start the economy going and we have to rely on the scientific evidence. And the scientific evidence that we are told is that transmission risks are incredibly low. And our providers, operators, whether they be childminders, nurseries or preschools, will do everything they can to minimise that risk. We're going to operate in what we call very small bubbles, and we will keep with those children. So again, transmission will be limited. So I think we will do all we can. I don't think that's the main issue for the sector, to be absolutely frank with you. I think ours is one of funding. I mean, before all the pandemic, to put this into context, independent researchers were telling us that we had something like at least $750 million shortfall on the so-called free entitlement from government. You had Her Majesty's Chief Inspector of Ofsted last year, in responding to a parliamentary question, telling them that nearly 500 providers every single month were going by the wayside. And that means that thousands of places for children and families will have been lost locally. So it doesn't tell you that everything's rosy. So to now have the problem of having to bring more staff back into the environment, disproportionate costs, and frankly being ignored when it comes to funding, that's going to be the main issue for the early years sector. I mean, just a couple of weeks ago, we were told that 1 in 4 providers felt they were unlikely to be open in 12 months' time. And yet when the heat of the pandemic was there, it was early years providers opening up their doors and making sure that we were there for critical and key workers. So, a plea to the Chancellor, do the honourable thing and adequately fund this sector.
Let's just break it down slightly, because obviously funding is clearly a very big concern, but you've got to be aware that, trying to get more money out of anything at the moment is going to be hugely problematic, when obviously there's been billions upon billions upon billions of pounds in terms of the furlough scheme, in terms of extra money to the NHS. It's going to be a struggle to get any more money out of anybody, isn't it?
Well, it's always been a struggle, but the reality is, if ever there was a position where it's quite clear that early years education and support has to come to the fore, it's been now. So this is part of our social infrastructure. You need to invest. And when we want to find money, when we want to put on the Olympics, where the budget went from 2 billion to 10 billion, when we want to build rail links that go way over the original costings, we find the money. How is that a priority over early years? I just can't see that's the case. So when we want to do something, we find the money, and this is a priority.
Okay, back to getting things reopened. What about those members of staff who aren't comfortable? Would you support them if they say, look, I don't want to come back at the moment?
Well, what providers are doing is they're talking with their staff. And of course, if there are vulnerable staff, if they have concerns, then that's part of the negotiation. Nobody is looking to force people back into an environment. But I would reiterate that if you're able to operate, operators will be doing so knowing that it's safe to carry out this work. But similarly, if you're operating in an environment where you cannot do that, you can't separate children, you can't isolate them. And similarly, as I say, that's the right of providers to make sure that they keep not just the children safe, but they keep their workers safe. Main priority.
Neil Leitch, good to talk to you.
Thank you.